Hello, and welcome back to Conversations in English. I'm Martha.
And I'm Bob. We're so happy you're here with us today.
This podcast is for anyone learning English who wants to hear real, natural, everyday conversations. We keep it simple, we keep it friendly, and most importantly, we keep it useful.
That's right. And today's topic is something that is so important for everyone. Whether you're learning English, whether you've been speaking English for years, or whether you're just visiting a new country.
Today we're going to talk about how to speak to your doctor in English, specifically how to describe pain and how to explain your symptoms clearly.
Because let's be honest, even in your own language, trying to explain exactly what is wrong with your body can be really difficult.
Oh, absolutely. I always walk into the doctor's office and suddenly forget every word I know.
Exactly. So today, Martha and I are going to role-play some real conversations, the kind you might actually have at a doctor's appointment. I'll be playing Dr. Roberts, and Martha will be playing different patients.
And before we get started, we do want to say very clearly that Bob and I are not doctors. We are not medical professionals. Bob is not a real doctor.
No, I am absolutely not a doctor. Everything you hear today is just for language learning purposes. It's to help you find the right words and phrases in English. If you have a real health concern, please see a real doctor or healthcare professional.
Exactly. Think of today's episode as a language lesson dressed up as a doctor's visit. Okay, are we ready, Bob?
I'm ready. Let me just put on my imaginary white coat. There we go. Actually, before we jump into the role play, let's give our listeners a few very useful sentence patterns, just so you can follow along and start picking up the patterns as you hear them.
Great idea. So there are a few really natural ways to describe how you feel to a doctor in English. The first one is simple. Just say, I have, and then name the problem. For example, I have a headache, or I have a sore throat.
Then you can use I feel followed by an adjective, a describing word, like I feel dizzy, or I feel nauseous, or I feel very weak.
You can also say, my body part hurts. So, my back hurts, my chest hurts, my knee hurts. Very direct, very clear.
And one more useful pattern. It hurts when and then describe what you are doing. For example, it hurts when I swallow, or I feel dizzy when I stand up quickly. This helps the doctor understand what triggers the problem.
Perfect. Keep those 4 patterns in mind as you listen to our conversations. You'll hear us use all of them. Shall we start with our first scenario, Bob?
Good morning. Please come in and take a seat. So, what brings you in to see me today?
Good morning, doctor. Thank you for seeing me. I've been having some pain in my chest, and I'm a little worried about it.
I understand. You were right to come in. Can you describe the pain for me? What does it feel like?
It's a bit hard to describe. It feels like a heavy weight pressing on my chest, like someone is sitting on me.
Okay, that's very helpful. That's called a pressure sensation. Does the pain stay in one place or does it spread anywhere? For example, does it go up to your shoulder or down your arm?
Actually, yes. Sometimes it does spread up to my left shoulder and into my neck. I didn't think that was related.
That's actually very important information. Now, on a scale from 0 to 10, where 0 is no pain at all and 10 is the worst pain you can imagine, where would you put this?
I'd say about a 5 or a 6. It's moderate. It's distracting, I notice it, and it makes it hard to concentrate, but I can still talk and function.
Good. And when did it start? It seems to flare up when I climb stairs or when I walk quickly.
It started about 3 days ago. It came on gradually at first, but yesterday it was worse. It seems to flare up when I climb stairs or when I walk quickly.
So, physical activity makes it worse. Does anything make it better?
Yes, when I sit down and rest, it usually settles down after about 15 or 20 minutes.
Thank you. You've described all of that very clearly. Let's run some tests.
Notice how I used an analogy. It feels like a heavy weight pressing on my chest, and I described where the pain spreads and what makes it better or worse. These details really help doctors understand what's happening.
Exactly. And Martha used a pain scale. I'd say about a 5 or a 6. Doctors use that scale all the time. 1 to 3 is mild, 4 to 6 is moderate, and 7 to 9 is severe. Let's move on to our next scenario. So, what seems to be the problem today?
Hi, doctor. I have a really bad headache. Actually, it's been going on for 2 days now, and it's getting worse.
I'm sorry to hear that. Can you describe the headache for me? Is it on one side of your head or both sides?
It's mainly on the right side, right here behind my eye, and it throbs. It's a throbbing, pulsating pain.
A throbbing pain behind the eye. That's important to note. On a 0 to 10 scale, how severe is it?
At its worst, I'd say an 8 out of 10. It's really quite severe. Yesterday, I couldn't even have a normal conversation. I just had to lie down in a dark room.
Does light or noise make it worse?
Yes, very much so. Bright lights are unbearable, and loud sounds make my head pound even more.
Have you experienced any nausea or vomiting?
Yes, I threw up once yesterday, and I feel nauseous right now, to be honest.
This sounds like it could be a migraine. We'll want to explore that further. Notice how Martha used threw up. That's a very natural phrasal verb that native speakers use instead of the more formal word vomit. And the word throbbing describes a rhythmic beating kind of pain, very specific and useful.
Right. Let's continue with scenario 3.
Hello, come on in. What can I help you with today?
Hello, doctor. I've been having stomach pain for about a week now, and it's really been affecting my daily life.
I see. Can you show me roughly where the pain is?
It's here in my upper abdomen, just below my ribs on the right side, and sometimes it spreads around to my back.
What does the pain feel like? Burning, cramping, sharp?
It's mostly a burning sensation, like acid almost. But after eating fatty food, it becomes more of a sharp, stabbing pain.
So food triggers it. Does anything make it better?
Yes, antacids help a bit. And if I don't eat for a while, the burning settles down.
Any other symptoms? Nausea, changes in appetite?
I have felt nauseous quite a bit, and I've lost my appetite a little. Oh, and I broke out in a rash on my stomach last week. I don't know if that's related. Plus, I've been coming down with what I thought was a cold. I felt feverish a couple of days ago.
That's all very helpful information. Thank you.
Did you catch those phrasal verbs? I broke out in a rash means a rash appeared suddenly. And I've been coming down with something means you're starting to get sick. Very common expressions.
Exactly. Now, our final scenario, back pain. Good afternoon. What brings you in today?
Hi, doctor. My back has been absolutely killing me for the past 2 weeks. I can barely function.
I'm sorry to hear that. Where exactly is the pain? Upper back, lower back?
Lower back, right in the middle, and sometimes it shoots down my right leg all the way to my knee.
Pain that travels down the leg is called radiating pain. Does the leg feel tingly or numb at all?
Yes, it tingles sometimes, a pins and needles feeling, and occasionally my foot feels a little numb.
On the pain scale, how would you rate the back pain?
The back pain is about a 7. It's severe enough that I can't sit for very long and I'm struggling to sleep at night.
Did anything cause it? Did you injure yourself?
It started suddenly.
I was lifting a heavy box at work and I felt something go in my lower back. It was immediately about a 9 out of 10. Really debilitating. I also have an old back injury and that seems to be flaring up again too.
So you have a chronic condition as well. Does anything give you relief?
Heat helps. A hot water bottle. And lying flat on my back with a pillow under my knees seems to take the pressure off.
Perfect. Notice the word Martha used, flaring up. If you have a chronic condition and it suddenly gets worse again, you say it has flared up. And pins and needles is that tingly, prickly feeling. Very commonly used expressions.
Okay, before we wrap up, let's do a quick recap of the most useful words and phrases from today.
For describing pain types, remember sharp or stabbing, dull or aching, throbbing or pulsating, burning, and tingling or numb. Each one gives the doctor different information.
The 4 key sentence patterns, I have a, I feel, my body part hurts, and it hurts when I, always tell your doctor the location, when it started, and what makes it better or worse.
And the pain scale 0 to 10, 0 is nothing, 1 to 3 is mild, 4 to 6 is moderate, 7 to 9 is severe. Those phrasal verbs, throw up, flare up, come down with, break out in a rash, use those and you'll sound very natural.
And that brings us to the end of today's episode. We really hope this was helpful, whether you're visiting an English-speaking doctor, traveling abroad, or just building your medical vocabulary.
Remember, we are not doctors. Everything today was purely for language learning. If you have any real symptoms or health concerns, please go and speak to a qualified medical professional.
But we do hope that now you feel a little more confident about explaining how you feel in English. Practice really does make perfect, so try saying some of these phrases out loud. Make them your own.
Thank you so much for listening today. If you enjoyed this episode, please check out our other conversations. There are lots more to help you practice your English every single day.
Until next time, keep listening, keep practicing, and keep the conversations going. Take care, everyone.
Bye for now.
Bye-bye.